Do you ever wonder why knowing CPR is so important? Imagine this scenario. Someone in your vicinity suddenly collapses, unresponsive and not breathing. You're the only one around. What do? CPR, or cardiopulmonary resuscitation, can be a game changer in such situations, potentially saving lives. CPR is an emergency procedure that combines chest compressions with artificial ventilation. The goal? To manually restore blood circulation and breathing, maintaining intact brain function until further help arrives. This procedure is crucial for individuals who are unresponsive, not breathing, or showing abnormal breathing patterns, such as agonal respirations. So how can you perform CPR? First, ensure the safety of the scene and then approach the person. Check for responsiveness by shaking or tapping the person's shoulder and shouting, "Are you okay?" If the person is unresponsive, send someone to call for emergency medical services. If you're alone, do this yourself before proceeding with CPR. Next, place the person on their back on a firm surface. Kneel beside them and place the heel of one hand on the center of the person's chest. Place your other hand on top of the first, interlocking your fingers. Now it's time for chest compressions. Push hard and fast, compressing the chest at a rate of at least 100 to 120 compressions per minute. The depth of compression should be 5 to 6 centimeters. If you're trained in CPR, give 2 rescue breaths after every 30 compressions. If not, continue with chest compressions until help arrives. For children, a combination of compressions and breaths is recommended due to the prevalence of respiratory issues in this age group. The aim of CPR is to restore partial blood flow to vital organs, delaying tissue death and extending the window of opportunity for successful resuscitation without permanent brain damage. Defibrillation, which is particularly effective for certain heart rhythms like ventricular fibrillation, is often required to restore a viable heart rhythm. CPR should continue until the person exhibits signs of return of spontaneous circulation or is declared deceased. In conclusion, CPR is vital. It's an essential skill that can significantly improve outcomes in emergency situations. It's a procedure that combines chest compressions and artificial ventilation to manually restore blood circulation and breathing. It can delay tissue death and extend the window of opportunity for successful resuscitation. So remember the key steps involved. Ensure safety, check responsiveness, call for help, start chest compressions, and provide artificial ventilation if trained. CPR can, quite literally, be a lifesaver.